Hello everyone, welcome to my YouTube channel Logic Medico. Today's interesting topic is development of this organ. This organ is pancreas along with its congenital anomalies. If you are new to my channel, kindly press the subscribe button, also the bell button to get the latest notification of the videos which I upload. Thank you in advance. The development of pancreas will be discussed under the following heading: the diagrams for better understanding, notes to replicate in the exam, development of pancreatic duct system with anomalies, what is the embryological basis for those anomalies. Okay, so this is the objectives for today's presentation. The pancreas developed from foregut, that is the endoderm of the foregut. Now what is this foregut? Initially the embryo will be surrounded dorsally by amniotic cavity, ventrally by yolk sac. Okay, once this head fold starts forming, the yolk sac is drawn into the embryo to form the gut or the GIT, gastrointestinal tract. Okay, so foregut is that part of the yolk sac which is drawn into the embryo into this area, that is a head fold. Later the foregut elongates and comes to being placed below the diaphragm. Later it forms a J-shaped organ, that is a stomach. Just below that will be the duodenum. So the development of pancreas takes place from the endoderm of the foregut at the level of duodenum. Okay, if you know gross anatomy, pancreatic juice opens into the duodenum. So let's see this. This is the lower end of the foregut. You can see a fusiform dilatation which later becomes a stomach. This is the duodenal area. So this pancreas develops as a endodermal outgrowths. Okay, so development of pancreas takes place from the endodermal outgrowth at the level of duodenum. So one of the growth is from the ventral area. You can see the cut section in the same thing for a better understanding. This is a duodenum. This is a ventral aspect or the anterior aspect. So dorsal aspect. So there is one bud growing anteriorly. It's called the ventral pancreatic bud. Another bud growing dorsally. It's called dorsal pancreatic bud. Of course, the dorsal pancreatic bud grows much rapidly than the ventral pancreatic bud. So where exactly this develops? So this pancreas develops from two buds, ventral and dorsal pancreatic bud. So what happens? This dorsal pancreatic bud develops during 4th week of intrauterine life from the dorsal aspect of the duodenum, slightly headwards. Okay, you can see that it's growing slightly headward and just above the hepatic bud. Hepatic bud will be growing here at a lower level. Okay, so this will actually grows into the dorsal mesogastrium and mesoduodenum. It will contribute to the entire pancreas except the head, lower part of the head, and the uncinate process, the dorsal pancreatic bud. Okay, whereas the ventral pancreatic bud commences at the lower level of the hepatic bud. Okay, hepatic bud or the bile duct. So here it is there in the junction between foregut and midgut. Initially it is a bilobed structure, later it fuses to form a single lobe. Okay, that point is important though. Initially it is a bilobed structure like a snake's tongue, it will be there. Later it fuses to form single structure. Subsequently what happens? There is one rotation. The duodenum, which was initially there is ventral and dorsal pancreatic bud is present, ventral and dorsal, that is anterior and posterior. Later the duodenum falls to the right. Okay, when it falls to the right, the ventral pancreatic bud will now become right, whereas the dorsal pancreatic bud now becomes left to the patient. Okay, this will become right and this is the left side of the patient. You can see the gastric bubble, now it's becoming the actual J-shaped contour is coming. This is becoming the stomach and duodenum is getting the C-shaped contour. If you take a cut section here, you can see clearly the duodenum. Initially the ventral pancreatic bud was here now, so there is 90-degree rotation. See, it's come here to the right side, whereas the dorsal pancreatic bud which was here, now it is moved here. Okay, so there is a 90-degree rotation. That's because the duodenum falls to the right. It's in the abdominal cavity. Okay, by understanding this, subsequently what happens? The ventral pancreatic bud, you can see in the previous thing I have shown one arrow. It grows, the ventral pancreatic bud grows around the duodenum on the posterior aspect. Okay, this is because of axial rotation of duodenum. So it grows like this and comes and joins the lower portion of the dorsal pancreatic bud That is because of axial rotation of duodenum. You can clearly see here ventral pancreatic duct has grown and come and attached to the lower portion of the dorsal pancreatic bud. See, dorsal pancreatic bud is really elongated. This is a cut section showing the same. This is a duodenum. This is a dorsal pancreatic bud. This is a ventral pancreatic bud. So this is because of the axial rotation of duodenum. The ventral pancreatic bud moves across on the posterior surface of duodenum to join the lower portion of the dorsal pancreatic bud. Both the buds fuses with one another, also the duct system, to give rise to the pancreas. So what is the fate of the dorsal pancreatic bud? It gives rise to the upper portion of the head. You can clearly see neck, body and the tail. Whereas ventral pancreatic bud contributes to the lower portion of the head and a tongue-like projection called as uncinate process. So in summary, the pancreas develops from two buds from the lowermost part of the foregut as an endodermal outgrowth, ventral and dorsal pancreatic bud. Later the duodenum falls to the right, so this makes the ventral bud comes to the right and dorsal bud goes to the left. Dorsal bud grows much rapidly than the ventral bud, that also we can see. Subsequently there is an axial rotation. The duodenum rotates on itself, so the axial rotation of the duodenum brings the ventral pancreatic bud to rotate across the posterior surface of duodenum to touch and join the lower portion of dorsal pancreatic bud. Ultimately the pancreas are formed, the duct systems are fused and it opens into the within the second part of duodenum. Ultimately the lower portion of the head and uncinate process is developed from ventral pancreatic bud. The upper portion of head, neck, the entire body and the tail is derived from dorsal pancreatic bud. Come to the pancreatic duct system, a small note. The pancreatic duct system, there are two duct systems, right? The dorsal pancreatic duct and the ventral pancreatic duct will be there. So what happens? Initially there is an oblique cross communication between the two. That is the dorsal pancreatic duct and the ventral pancreatic bud. Within the ducts there will be an oblique cross communication. So this is called the main pancreatic duct. It's also called herringbone pattern because it resembles a fish bone with all its ribs. You can see it will be like that, okay, like a bone of a fish after you eat the fish, like that, okay. So this main pancreatic duct is formed by three sources. What are they? From the distal portion of the dorsal pancreatic duct, the oblique cross communication between the two ducts, and the proximal portion of the ventral pancreatic duct. So here it joins with the bile duct to form the common bile duct, okay. This is called the main pancreatic duct or the duct of Wirsung, okay. This will open into the major duodenal papillae, whereas you can see this tiny duct here, right? So this is from the proximal portion of dorsal pancreatic bud. This is called accessory pancreatic duct. It opens into the minor duodenal papillae. So this is about the development of duct system of pancreas. In summary, the main pancreatic duct develops from the distal portion of the dorsal pancreatic bud, oblique cross communication, and the proximal portion of ventral pancreatic bud, whereas the accessory pancreatic duct is developed from the proximal portion of dorsal pancreatic bud, okay. So same thing in the form of notes I have written here. Main pancreatic duct is also called duct of Wirsung, ventral pancreas plus the oblique cross communication, this one, and distal portion of, this is the ventral pancreatic bud, oblique cross communication, distal portion of dorsal pancreatic bud, whereas the accessory pancreatic duct is also called duct of Santorini, okay. It's developed from proximal portion of dorsal pancreatic bud, okay. So sorry about this. The development of pancreas takes place between 4th and 7th week of intrauterine life. It begins to form at 4th week of intrauterine life. It fuses with the dorsal pancreatic duct and the duct system also fuses with one another, but completely it is formed by 7th week of intrauterine life. In summary, the pancreas develops from two bud, ventral pancreatic bud and dorsal pancreatic bud, from the lowermost end of the foregut, that is at the level of duodenum. Ventral pancreatic bud, dorsal pancreatic bud. What is the fate of the ventral pancreatic bud? You can tell. Lower half of the head of pancreas and uncinate process. It's a correct answer. Good. Dorsal pancreatic bud gives the upper half of the head of the pancreas, neck, the entire body and the tail of the pancreas, because dorsal pancreatic bud is really large, okay. So that is about the summary, simplest form of notes. right? This was just for a 3 marks question. If it is asked, you should be able to write like this. Let's come to the anomalies of the pancreas. Each anomaly can be asked for 3 marks. Pancreatic divism. So what is this? Failure of the fusion between the duct system of the ventral pancreatic bud and dorsal pancreatic bud. When they don't fuse with one another, then it's called as pancreatic divism. Okay, so that time the pancreatic juice will come from tiny ducts, so it will have difficulty in ending into the duodenum. Okay, next interesting condition is annular pancreas. So what is this annular pancreas? A ring of pancreatic tissue surrounds the second part of duodenum. It's called as annular pancreas. Remember I told you ventral pancreatic duct will be a bilobed structure. So if one of the lobe will grow front of the duodenum, another lobe grows behind the duodenum, it will surround the second part of duodenum. So it is 1 in 15,000 live births. It's more common. It is associated with other anomalies, other congenital anomalies. So whenever you see annular pancreas in a child, you should rule out esophageal atresia, congenital heart disease, and Down syndrome. So these are the other congenital anomalies which are associated with annular pancreas. Next anomaly is ectopic pancreas. So what is ectopic pancreas? The pancreas are present elsewhere. So it lacks anatomical and blood continuity with the normal pancreas. Neither the blood supply will not be there with the normal pancreas. It is somewhere else. The pancreas is present somewhere else where you didn't expect it will be present over there. It is present within the stomach, okay, gastric antrum, within the wall of the duodenum, proximal duodenum, the two, and jejunal wall, gallbladder wall, colon, that is large intestine wall. These pancreatic tissues are present elsewhere rather than normal position. That is called as ectopic pancreas. It is 1 to 15% incidence, and it mainly asymptomatic. It can be incidental finding when you do an endoscopy. You can see an additional tissue present within the stomach and duodenum. And come on to the last, pancreatic agenesis. Whenever the pancreatic buds complete failure, complete absence of the development of the pancreas, such this person when they're born, they will have all insulin deficiency, glucagon deficiency, hormonal deficiencies. So they'll be diabetic. They have metabolic syndrome. It's extremely rare but possible. Next one is hypoplasia of dorsal pancreas. So dorsal pancreatic bud, when it grows really less, so ultimately you'll have a long pancreas or a short pancreas. Guess. Dorsal pancreas, there are two buds now, ventral and dorsal. So dorsal pancreatic bud, hypoplasia. Hypo means less growth. Okay. So it will result in congenital short pancreas. There will be pancreas, but it's really short. Okay. Kindly like and share this video with your family and friends. Don't forget to press the thumbs up button. Also subscribe to my channel and press the bell button to get the latest notification of the videos which I upload. Thank you once again for watching this video and learning from it. Thank you.